Hi, in this video we'd like to come back on the discussion of Hyperemesis Gravidarum, and we'd like to discuss some specific symptoms that some women might experience. So as we all know, Hyperemesis Gravidarum is a rare life-threatening pregnancy disorder that can threaten the mother's life and also the fetus life. It is commonly characterized with three distinct symptoms. First of all is the excessive nausea and migraines that you will experience during this period of hyperemesis, which can go up to several months, all the way until labor. That's how severe it is. The second symptom is the excessive salivation. This is a distinct symptom that allows us to differentiate between morning sickness and hyperemesis. Although a lot of doctors, especially inexperienced ones, will believe that morning sickness and hyperemesis is the same thing. It's entirely different in pathology and also in certain symptoms. That's how we diagnose this rare and life-threatening condition. The third distinct symptom is the insomnia that a lot of patients will experience. Now this insomnia is very grueling, especially if you are carrying a child at the same time. It can cause several other secondary symptoms, for example, the depression, the mental instability, the mood swings, the malnourishment, dehydration. All of this can affect the development of the baby and also the mother's life. So it is indeed something that needs serious medical attention and immediate management as well, so that we don't anticipate or experience any pregnancy loss, which is a very high possibility. So in today's video, we'd like to go through a few symptoms that we have experienced with our patients, and we'd like to share a little with those who are keen about learning about hyperemesis and its distinct symptoms. Now, besides the three that I've just mentioned, today I'd like to talk about a few rare ones. For example, tachycardia, which is an abnormally high, elevated, rapid heartbeat. I'd like to define this as having more than 100 beats per minute. This is already considered extremely high and abnormal, and is associated with hyperemesis. So if you do experience heart palpitations, rapid heartbeat associated with this vomiting, insomnia, it could very well be hyperemesis already. Second one is the electrolyte imbalance. Specifically is the abnormally low levels of potassium and sodium. We know them as hypokalemia and hyponatremia. Low levels of potassium and sodium will affect nerve tissue and then also muscle contraction. Especially what we like to specify here is the contraction of the heart muscles, which is why we can see a lot of our patients, when they do have hyperemesis, they will have these heart palpitations and also excessively high rapid heartbeats, because the electrolyte imbalance is going much severe. Furthermore, we'd also like to talk about how some patients develop rashes and also heartburn in the chest area. This is also associated with hyperemesis, but it's of course much rarer. It's something that we do want to keep in mind. And then you also might experience throat pain from the excessive vomiting that you are experiencing. Throat pain is also something that we can do differential diagnosis, and patients do need to keep note of what they are experiencing during this period, especially those of you who are experiencing hyperemesis for the first time. Many doctors still believe that it's entirely psychological, and sometimes they still think that it's morning sickness. Here at Antai Hospital, we have been dealing with hyperemesis patients for over the last 20 years, and we have been offering a highly effective HCG desensitizer that we have formulated in our hospital that is highly effective in seeing full recovery within a week for our patients who are suffering from this condition. Now, if you're worried that if this medication will affect the fetus development, whether or not it will affect the baby, rest assured, this medication is specific to the receptors that is associated with hyperemesis. It will not pass through the placenta, as the molecular size is far too large for it to go through the placenta, so there will be no interaction with the fetus. This treatment comes with a full refund guarantee because of how effective it is a success rate of up to 95%. So do get in touch with us as soon as you can, and also read our articles, watch our other videos about hyperemesis. And if you'd like to actually seek this treatment, please arrange a consultation with us today so that we can make the necessary arrangements and you can receive this treatment so that your next pregnancy can be a smooth and healthy one, and we don't have to experience any suffering, any traumatic experience, and any pregnancy loss.